New research says that pregnancy changes nearly every part of a woman's brain. More than 80% of the regions studied had reductions in the volume of gray matter where thinking takes place. While less gray matter may sound bad, researchers say it more likely reflects the fine tuning of neural circuits to prepare for a new phase of life. This study only looked at one person, but aims to scan the brain of hundreds of women and could one day provide clues about disorders like postpartum depression. Joining us now to discuss this research is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, always great to have you on.
Great to be here.
Now, how much of a benefit will these findings have on women's mental and even physical health?
I think we're seeing these recent findings that might hold significant potential benefits there. Looking at it strictly from mental health, I think understanding postpartum depression, I think the study's insights can really look for markers that'll be helpful to identify postpartum depression and whether there's structural and functional changes there as well. What we do see in these studies as well is that there's likely this fine tuning of neural circuits. So that adaptation is likely going to increase the mother's ability to bond with her baby. We're also going to see likely some physical changes and benefits as well. So those changes will cause an enhanced connectivity and efficiency in neuronal circuits. So that means better able to manage stress and physical exhaustion as well. So I think there's a lot of potential here. If we look at, the global health impact, over 140 million women giving birth every year globally. So any of the research that we have that can be helpful certainly makes a huge difference.
Now, women have been getting pregnant for quite some time. Why did it take until 2024 for scientists to finally make this discovery?
Right. That is the interesting question as well, right? So I think historically the focus for maternal health has been more on physical health to really ensure successful pregnancies, and we haven't really looked at the neurobiological changes in great detail. Overall, when we look at the whole fraction of studies, even in neuroscience, maybe 0.5% of all the published neuroimaging studies really looked at health factors specific to women. So in this case, it's not surprising to see such a huge gap here, but certainly there's a lot of improvement. I think we are having social attitude shifts towards more equality, including in studies. That comes with better funding and prioritization and increased awareness as well.
Now, I know this is still a new study, but will we know if there's a difference in brain activity during pregnancy opposed to menstruation or menopause?
Right. So because it's so new, I think it's going to be hard to really quantify that. But what we can do is we certainly can, look at the potential that we would see. So brain activity, for instance, in menstruation, we expect, and we've seen in previous MRI scans, that there's the rise and fall of sex hormones during the menstrual cycle. And that certainly will make changes in the brain as well, especially around emotions, memory as well. And we see side effects of that. You can see some cognitive changes and irritability and mood swings from these hormonal shifts. For menopause, we see something similar where there's a significant decline in estrogen and progesterone receptors. So the brain PET scans that we do show that there's increased receptor density in the brain to compensate for this. But those changes in the brain can also cause issues with cognitive functioning and memory issues as well.
Now, the study shows that the gray matter in the brain changes when a woman is taking on a new phase of life. So, will this brain activity be the same for a woman that's been pregnant 3 times opposed to a woman expecting for the first time?
I think that's a great question. I think what we're going to see is some plasticity, especially in the first time, where there might be more changes that are occurring. So that neuroplasticity will be quite high. With subsequent pregnancies, I think you'll see less of an adaptation here. And that's because, if you're fine tuning something, it's already been fine tuned. So you don't have to take big steps to change too much. So in multiple pregnancies, you're likely seeing an enhanced efficiency. So it doesn't need to be changed as much.
Now, it's talked about that this study might actually help with postpartum depression in the long run. Just how common is postpartum depression in Canada, and what are the main signs and symptoms?
Postpartum depression is very significant in Canada. So we expect around 23% of all new mothers to experience symptoms of postpartum depression or anxiety disorder there. And this really ranges from provinces to provinces. Saskatchewan has 16% and Nova Scotia has 31%. So the concern here is there's a significant amount in Canada. What we see with that is emotional symptoms as well, behavioral symptoms, sometimes difficulty bonding with the baby as well. And the big thing that I would say is if we have someone who has those symptoms, it is crucial to find and make that diagnosis early so that we can provide timely support and treatment. So please reach out to your healthcare provider, your family doctor, your midwife, or any mental health professional if you're suspecting you have postpartum depression.
Dr. Raut, thank you so much.
Thanks so much for having me.